Welcome back, everyone. I hope you agree with me that it's been a splendid session so far, and thank you very much for all the wonderful questions. We're working very hard to respond to all of them. So I think we've got now 137 participants. I think they all joined us before the session ended. So just in case you are a complete newcomer, there is a Q&A chat line at the bottom of your screen. So place any questions you have for the speakers. So it gives me great pleasure to introduce our people with severe asthma who are living with severe asthma. So Iranzu Muerza Santos from Spain, Professor Vanessa MacDonald, who's a professor of chronic disease nursing at the University of Newcastle, but not Newcastle, UK, but Newcastle, Australia. And wonderful to have her, especially because of the time difference. And she's the co-director of the Center of Excellence in Severe Asthma and director of the Center of Excellence in Treatable Traits. So really well received. Dominique Hammerlink was the initial co-chair with me, the patient co-chair in SHARP, and she's worked as a patient expert in numerous ventures, all in relation to severe asthma, and she's a splendid lady. I can vouch for that. Maja Zrnic is a nurse at the Golnik University Clinic for Lung Diseases and Allergy in Slovenia. If you haven't been to Slovenia, let me strongly recommend it. It's a wonderful country to visit. And Maja is a part of a multidisciplinary team for the treatment of severe and problematic asthma. So once all our speakers are presented, there will be time for a joint question and answer session. So please do put your questions in the Q&A box. So over to you, Iranzu.
Hola, mi nombre es Iranzu Muerza y soy paciente de asma grave de control. Vivir con asma grave para mí supone vivir con miedo a morir cada día. Es así de duro decirlo, pero hay que convivir con ello. También hay que sacar fuerzas, hay que ser un paciente vital, ¿no? Tienes que conocer tu enfermedad, preocuparte por ella, saber cómo funciona, aprender también, ¿no?, de los tratamientos que te dan, qué son, cómo funcionan, para qué los tomas, si te hacen unos efectos más positivos que negativos, en fin. Y desde entonces, pues bueno, decidí tomar las riendas de mi enfermedad y a partir de ahí, pues bueno, aprender, conocerla bien, conocer mi cuerpo, que es fundamental también para poder controlar este tipo de enfermedades y sobre todo no venirse abajo, ¿no? A pesar de que de todos los efectos secundarios y de que un asma grave afecta a todos los niveles de la vida, ya sea físico, mental o social, eso es muy importante también, sobre todo pues, apoyo de los cuidadores o de familiares que podamos tener, que también ellos tienen que llevar un proceso de asimilación de la enfermedad que tenemos, debido a que ellos van a ser nuestro apoyo a partir de ese momento. Yo, por ejemplo, lo que siempre cuento es que yo, por ejemplo, necesito ayuda hasta para ducharme, ¿no? Es decir, yo ya no soy capaz de tener una ducha sola sin la asistencia de mi marido, en este caso, que es el que me ayuda, ¿no?, a llevar a cabo esas rutinas diarias en mi vida que yo sola, por mi enfermedad, no puedo. Entonces, lo que sucede es que si antes podías hacer 20 cosas, ahora puedes hacer 5, o tienes que aprender a hacer esas 5 de otra manera diferente a la que habías aprendido hasta ahora, ¿no? Pues con más calma, con más pausa, buscando trucos para facilitarte el trabajo o buscando ayuda, ¿no? Siempre. Pero bueno, esa independencia, ¿no? De poder hacer cosas tú sola, pues se pierde bastante con este tipo de enfermedades. Una de ellas es el peak flow, que entiendo que casi todos los pacientes, si no todos, tenemos uno, que es donde nos marca lo que es el flujo expiratorio máximo de un segundo. Entonces, esto serían bueno, los soplidos pertinentes y luego se recogería en lo que es en un diario, ¿no? Entonces, es muy importante, por ejemplo, hacer ejercicios del peak flow, debido a que esto lo que nos da es una numeración que nos va a indicar día a día si nuestro asma pues, se estabiliza, mejora o empeora, dependiendo de los números que vayamos dando en los soplidos, ¿no? Que hagamos diariamente. Obviamente también es fundamental para los pacientes asmáticos hacer algo de ejercicio y algo de fisioterapia respiratoria todos los días. Yo aconsejo mínimo 15 minutos de fisioterapia respiratoria haciendo pues diferentes ejercicios, o bien respiraciones abdominales, costales, pulmonares, o bien haciendo algún otro tipo de ejercicio, digamos. Por ejemplo, hay pues fisioterapia con pilates, pues se pueden encontrar vídeos en los que hay profesionales que son fisioterapeutas respiratorios que hacen vídeos, ¿no? Sesiones de fisioterapia respiratoria para que puedas hacer cada día. Y aparte de la fisioterapia respiratoria, es fundamental hacer deporte. Al alcance de cada uno, ¿no? Quiero decir, no todos vamos al mismo nivel. Obviamente, cada uno tiene que ajustar el deporte que le vaya a él. A la mayoría de gente le viene bien andar, ¿no? Pues andar es un ejercicio muy sano. Y luego, pues por ejemplo, la bicicleta también es muy buena para pacientes asmáticos. Al final eres tú como propio paciente el que te tienes que valorar, digamos, ¿no? Tu situación y hasta dónde llega tu capacidad pulmonar y tu capacidad física para realizar un deporte. Pero es fundamental que cojamos la costumbre de hacerlo todos los días. Sé que cuesta, sé que muchas veces los pacientes, pues eso, pues no nos encontramos bien, porque no descansamos bien, porque nos encontramos fatigados, por lo que sea, pero mínimo algo. Es conveniente llevar un diario de asma donde podamos apuntar las diferentes mediciones que llevamos a lo largo del día, ¿no? Por las mediciones de peak flow, las mediciones de oxígeno, de pulso, tensión, temperatura, si hemos tomado inhaladores de rescate, cuántas veces lo hemos utilizado, si hemos visto cambios en las flemas, si hemos visto algún cambio de temperatura. Entonces, todo este dato, o sea, la anotación de todos estos datos diarios nos permite dos cosas. Por un lado, el autocontrol del propio asma, es decir, tú vas a ver si tus mediciones mejoran, empeoran o se estabilizan, y dependiendo de eso, pues tomar unas medidas u otras. Y por otro lado, también te sirve para que a la hora de ir a la consulta de tu neumólogo tengas datos exactos que enseñarle. Es decir, pues en este día tuve una crisis, aquí empecé pues a empeorar, a bajar mis mediciones de peak flow, aquí necesité un poco más de inhalador de rescate. Pero es muy importante prestarle atención a la salud psicológica, debido a que es la gran olvidada, porque el asma se piensa que es solo una enfermedad física, y realmente afecta muchísimo a nivel mental, y es, yo diría, obligatorio y necesario que vayan de la mano, ¿no? Lo que es el tratamiento en este caso, con el neumólogo, alergólogo, otorrino, etcétera, todos los médicos que llevemos, pero agregar también esa atención mental. Yo en mi caso, yo sí que tomo tratamiento psiquiátrico. Yo tomo tratamiento psiquiátrico para la ansiedad, para la depresión y digamos, para dormir, para mi insomnio, ¿no? Porque debido al asma grave que tengo, pues bueno, también tengo dificultades para dormir, muchas, porque creo que es fundamental para comprender, para convivir y para al final aprender, ¿no? A ser feliz también, que podemos ser felices también teniendo esta enfermedad, ¿no? Que si se quiere se puede. Tienes que ajustar toda tu vida a tu ritmo, no tu ritmo se tiene que adaptar a los demás, ¿no? Ahora tiene que funcionar diferente. El mundo tiene que ir a tu ritmo, no tú al ritmo de los demás. Y eso es muy importante tenerlo en mente. Con lo cual, por todo esto, pues debemos de tener nuestros trucos, nuestros consejos y sobre todo no rendirnos nunca, porque el ánimo y tener fuerzas y tener ganas es fundamental para convivir con el asma. El asma es una enfermedad que mentalmente puede afectar muchísimo y nos puede hacer aislarnos y meternos en un pozo que no nos lleva a ningún sitio, con lo cual vivir con asma no supone que no podamos vivir. Vivir con asma es difícil, no, nadie dijo que fuera fácil, pero hay que hacerlo, hay que pelear, hay que luchar por nosotros y por los que nos quieren y por los que vienen detrás. Si luchamos ahora, los que vienen detrás lo tendrán más fácil y simplemente por eso somos muy útiles. Por lo cual yo os aconsejo a todos que cojáis la rienda de vuestra vida, que disfrutéis de cada momento que nos regala la vida y que respirar es vivir y que viváis todos y que realmente hay que aprender a vivir con esta enfermedad, pero que con asma también se vive.
Many thanks to Iratsu for this wonderful, inspiring message, despite the fact that she's got quite severe asthma, as you heard from her. So she will be joining us for the Q&A. So it's a pleasure to ask Vanessa and Dominique, Professor Vanessa MacDonald. Thank you very much for joining us at this late hour for you.
Pleasure to be here.
Is Dominique able to join us? Yes. Okay. So
Yes,
I'll leave it over to you to have this conversation.
Yeah. Can you hear me, or is my
Very well.
sound still
Very
off? Okay, good.
Over to you too.
Thank you very much. And good. I was about to say good evening, everyone, but I guess it's good morning for most of you and evening for me. Hi, Dominique. It's lovely to see
Vanessa.
you. Yeah. So we're here today to have a conversation really about your experience of living with severe asthma and some of the challenges that you may have faced and some of the navigation that might be helpful for other people who have severe asthma. So we've had two great videos already this morning on people's experience living with severe asthma. So thanks very much to Hannah and Irantsu, sorry. But this is really about a conversation to explore some of the things that you've kind of experienced as part of your severe asthma journey, Dominique. So to get started, would you mind telling the audience how long you've had severe asthma for?
I couldn't tell you, actually. I started out sort of like Irantu having between 8 and 12 infections a year when I was in my teens. And I was only diagnosed with asthma when I was 25. And it's sort of when it progressed that each time my medication didn't work well enough. So I went to the next one and the next one and the next one. So I have no idea since when I have severe asthma. It's sort of my journey goes in sort of periods between 3 and 5 years that medication works and then it doesn't work anymore. And I progressively became more and more severe.
Mm. And I guess that's an important comment, because asthma might not necessarily start out as severe, but becomes more severe as people's journey progresses. So severe asthma presents differently in all people, and your experience is that it started with asthma and then gradually got worse. Treatments started to not work so well. So with that, can you tell us some of the burdens that you've experienced from living with severe asthma? So what are the impacts that severe asthma has on different areas of your life, and what areas of your life are most impacted?
I think there are no areas in my life that are not impacted. So I have a very unstable asthma, which I can be okay now, but be very breathless in 10 minutes. So it's very difficult to plan any activity, plan any work, plan anything basically, because I have absolutely no idea what will happen in the next 10 minutes. I have like I do follow air quality. My asthma is very related to air quality, to pollen, to the spores from fungal in November when it's hot and wet. And so it is very unpredictable, and it has sort of, I've had to, I'm no longer working except what I do as a patient expert.
Right.
I have to be very, very careful with my energy, because I sort of compare it to breathing is like running a marathon throughout the whole day. Your energy is limited. So it impacts everything. And I also sleep really, really badly. So
Yeah, and I think your story is not necessarily unique, because with many patients with severe asthma I talk to, they do kind of have that same experience where multiple aspects of their life are impacted. You've talked about work, about sleep, about you're just planning for the symptoms that you experience. Family life and social life, how do you find that they're impacted as well?
yeah, it's sort of very difficult to balance it, because as you can hear, I can have a lot of problems speaking, and even listening can be tiring. So I have limited social interactions. Basically, I love what happened with COVID is that we have everybody online, so I don't have to travel, and you can plan when you speak with people. So for me, that was a great improvement, but it impacts my social life and my family life incredibly. It's really, really limited.
Yeah, and as Ramesh was presenting earlier, he had that lovely schema that showed that there was asthma, but not only asthma, there were all these other complications or traits that were in association with that. And, you know, it can affect, and we heard in the videos as well, how it may affect people's mental health or psychological health in terms of getting people down from those experiences of limited social and family interaction as well. So this is a really large life impact of this condition. Can you tell me about some of the, say, coping strategies that you might use in order to manage this effectively? You've already said that you use an air quality rater because of the impact that air quality has on your life. And down here in Australia, and as well as many parts of the world, we have major bushfires and lots of climate change emergencies that impact people with severe asthma. I noticed in the chat there was a question about thunderstorm asthma. So those air quality raters are important. But what other strategies and coping mechanisms and digital tools might you use in order to manage your asthma more effectively, or manage the implications caused by other aggravating factors?
Yeah, it's sort of the problem is the balance between making your life smaller to avoid all these external factors. I quite often don't leave home because I know that the air quality and the pollen and everything impacts me very, very severely. Even when I'm inside, it's already hard enough to manage. So going outside and having a small walk is already quite difficult. And I've sort of given up on air quality and pollen information, because I checked everything for a very, very long time, because I had the feeling I have no idea what's happening. And now I have the feeling, because I did it so avidly, I know it's not in my mind, and it's not me that has doing stuff to my body to have all these bad periods. But by example, I know that I'm already ill from the pollen before the pollen counts are published. Mm-hmm. So it's sort of, you need to sort of get all this information, which is quite difficult and quite time consuming, and also continuously reminding yourself that you're not crazy. This is real life for you. So that's sort of where it goes.
Yeah, so I'm hearing that monitoring of your asthma symptoms is really important for you.
Yeah.
You can often recognize when things are getting worse before you actually even see the real life impacts of, say, the pollen counts and things like that. So I think that's a really important message about monitoring symptoms on a regular basis.
Yeah, and it is quite difficult because, by example, I have a nebulizer, and I don't want to over-medicate myself. And you have these symptoms that are very clear, and you have these symptoms that sort of, do I need to nebulize? Do I need to? So it's almost a daily task. And next to having all this program of taking all the regular medication, you continuously have to check yourself. What's going on? Do I know? Can I wait? Is it really, really bad? So it is a daily task, and it's the 24/7, 365 days a year daily task.
And I guess to manage it effectively, you're doing all these things at home 24/7, 365 days a year. But there's also the integral part of managing your asthma, which is the involvement of your healthcare team and the healthcare journey that you're on. So we've heard from Ramesh this morning about multidisciplinary severe asthma clinics and specialist severe asthma clinics. But you've also talked to us about the implications of your severe asthma, not wanting to leave the home because of the impacts of the symptoms. So I guess navigating that healthcare journey can become difficult when your symptoms are not controlled as well as you would like. So can you tell us a little bit about the challenges that you've experienced when navigating the healthcare system or the healthcare journey that you've been on?
Yeah, it's been very, very challenging. I sort of, my asthma doesn't fit into the sort of strict diagnostic health system. So I don't wheeze, I don't cough very often. All these things don't really happen. And so I've had multiple doctors either telling me, you don't have asthma. And I said, okay, if I don't have asthma, what do I have then? I'm never getting then a new answer. So they sort of, oh, I can't do anything for you anymore. So that's really frustrating because as a patient, you're put with your back against the wall. There's nothing you can do. You can't prescribe yourself your medication. Unfortunately, now I have I'm in a severe asthma clinic that is looking, but it is I have the unfortunate that I have a very difficult to treat asthma. So even on my maximum medication now, I'm hardly ever stable. So it is really, really complex. And in the Netherlands, we don't really have that many multi-system clinics. So I've basically a couple of years ago, after having had, which I didn't know was dysfunctional breathing, really, really severe problems breathing, we found out that it had that it actually had to do with CO2 levels, because my O2 level is always fine, my oxygen is always fine. And then I organized my own care. I went to my primary care physician. I said, this is what I need. I'm losing weight. I need to have help in figuring out how to improve my breathing. I need psychological support because I'm at the end of my tether, and I need a dietitian. And we organized it together, which was really, really good. Which has had a big impact on my life.
Yeah. And I think what you're saying is key. And it's another point that Ramesh made. You're just not experiencing severe asthma. There are many of these other complicating impacts of the disease, which my background being nursing, coming from specialist severe asthma clinics, I think is one of the key values of having those multidisciplinary clinics, because you can see a psychologist, someone to help with your dysfunctional breathing, someone to help with your diet and things like that. And I think what I also took from what you said is that you sometimes may not feel heard in terms of all this stuff is going on with you, but people are telling you, well, it's not asthma, it's not this. So that diagnosis aspect of severe asthma has been a bit of a challenge for you. And, you know, in the severe asthma management environment, I think that patient and doctor clinician partnership is really key, so that, you know, you're working together in order to improve your management and your control of your severe asthma. Do you have any comments you'd like to make about that?
One of the things I find, because we're sort of, I'm one of the people that's following new research, hoping that there will be new treatment, because I see the frustration in my clinician as well. Sort of, she hasn't got a clue either. This is what we can, this seems to be at this moment the maximum we can achieve, which is really, really bad. But we're sort of trying to figure out, but this is the maximum we can sort of do in also balancing between the effects of the medication, that's sort of the effect that has on your quality of life, and wanting to avoid having all these side effects of the medication building up, because they're already doing that enough. And And it is very, very frustrating for all of us if you have sort of nothing left in the bag.
Yeah, yeah, I understand that that you have been someone who actually hasn't had the greatest journey in terms of the medications working well for you, which is a really difficult situation for you to be in. So you've, from what I understand, trialed a lot of new different treatments that not worked as well as you would have liked them to. And I think that's important, because in the era that we're looking at severe asthma in today, there are lots of new treatments. Many of those are targeted to T2 high asthma. You've already said that you don't have T2 high asthma. So it does leave you at a little bit of a loss in terms of, well, what are my options for treatment? And I guess what I'd like to kind of talk about is how you might manage the expectations of starting new treatments, or what you think people should be aware of in terms of when you start a new treatment, kind of managing the expectation, thinking this might be something that works. Excuse my dog.
Yeah, I think it's an interesting question, Vanessa. I think we always hope that it will work, and that basically, I think one of my best coping skills, which doesn't work every day, is to try and stay optimistic, make silly jokes with myself, have a couple of good friends where we keep each other stable. But it is difficult you always hope with new treatments that they will work and that they will minimally help you feel better, sleep better, be able to do more on a day-to-day basis, be more independent. But and I have been following quite a lot of patients who are on the biologicals, and the response, as we will also hear later today, is very diverse. And it is, like Ramesh also said, everybody we always make jokes together. So, that's Dominique's asthma, and that's Truus's asthma. And that's the reality. There is no absolute guarantee that anything works, but it is worthwhile trying, and it's definitely necessary to have a conversation with your doctor on sort of the balance between the side effects and the positives, the negatives and the positives of each medication, so that you can make a good decision together.
Yeah, I think you've made some really key points in that statement. One was that not everybody's severe asthma is the same. And I think the more we recognize that, the better off all of us are as patients and as clinicians, so that we can kind of try and tailor management more individually. And I think the other key point that you've made there is that we need to work together. We need to work in partnership so that we can identify what are the specific aspects of Dominique as an individual, as Hannah as an individual, so that we can then look at targeting therapies according to the things that are going wrong with each individual. So I think they're really important things that you've mentioned. And you've talked about side effects of treatment as well. And I've been watching the chat and the questions and answers, and people have been asking about, oral corticosteroids and the side effects of that. And they're real things, and they're things that people with severe asthma can't easily navigate, because corticosteroids are very effective in terms of treating severe asthma. But I think there is hope. there are new treatments that are continuing to emerge. I remember when I started working in severe asthma many, many, many years ago, we didn't have any options to give people beyond high-dose inhaled steroids and oral corticosteroids. And now we have a whole kind of range of different treatments that are available, and that will continue to grow. And everybody will hear about those things as the morning progresses. But Dominique, I'm aware of the time. We had to 15 minutes past the hour. So I wanted to bring our discussion to an end. Yeah. I wanted to thank you for sharing your experience and the journey that you've had, and for raising those really important points that you have raised about severe asthma and managing your condition. And I know that people in the audience are agreeing and kind of sharing some of your frustrations and sharing some of your experiences, but and understanding that all of their asthma is different. So thank you for being so open with us and for and having the conversation with me.
You're very, very welcome.
Thank you very much to both of you, especially to you, Dominique. It's been a pleasure and an honor to have gotten to know you intimately. I would say you and I have been working together in Sharp, and I've got to admire both your the human side in you, as well as your professionalism when it comes to dealing with patient issues. So thank you very much indeed. We'll have opportunity to address some of the things that you two have talked about, but it's a pleasure now to introduce Maya, who will present to us. Maya, do tune in, please.
Hello everybody. Do you hear me?
Yes, absolutely well. Thank you, Maya.
Hello everyone. Thank you. I'm very happy to be with you today. Thank you for invitation. English is not my first language, but my third, but I will try very hard to make sure you understand me.
Thank you for can you click on the presentation mode at the bottom?
Does it move?
No, so that we have the full screen.
Okay.
In the bottom right corner, there's a little screen sign.
Uh-huh.
No.
Is it okay? Is it if is that way? It's okay.
It's if it's not possible to
yes, thank you.
Turn into let's stick with this then. Okay.
Okay. Thank you for your time, understanding, and patience. And thank you, Professor Dukanovic, for invitation to visit Slovenia. Let's begin. About severe asthma, we heard a lot. We must know that severe asthma affects 5 to 10% of asthma patients. Symptoms are daily extreme limitation of the patient's normal activity, and lung function is very poor. A patient has 2 or more exacerbations per year, and they need to take steroids. And we all know, we already heard the side effects of steroids, such as osteoporosis, diabetes, obesity, depression, and many infections. And approximately 15% of patients are suitable for treatment with biologic therapy. I'm sorry, I'm a little bit nervous. GINA, this is Global Initiative for Asthma, gave recommendation about a severe asthma patient, and they recommended that there must be appropriate patient management, a special institution, and multidisciplinary team. And our experience in Slovenia, we take a research, we analyzed 66 patients, average age was 55 years, and we looked at adherence and inhaler technique. And results are, there are poor adherence to treatments, just about 20%, and incorrect inhaler technique, approximately 15%. And the most common inhaler errors was inadequate breathing, inadequate exhalation, and improper coordination. Our conclusions are patient did not have proper prior education. There were lack of information, and here is the important role of registered nurse in patient education. And here is our multidisciplinary team, which includes a pulmonologist, a registered nurse, clinical pharmacist, which checks the level of adherence, is it low or is it high, and talks with patient about medication or comorbidities. There is a respiratory physiotherapist. He performs a 6-minute walk test on the patient, demonstrates breathing exercise and coughing techniques. Dietitian is involved if we need it. He performed body measurements, weight reduction, and various of diets. Clinical psychologist gets involved if the patient has expressed the fear, the distress, depression, he's just worried about the disease. And now the most important is a registered nurse. She is a key expert in MDT patient management. She guiding the patient through the treatment process, connecting team members with each other, and performs diagnostic procedures. In most important, here is a patient education because of asthma self-management. Evaluation of professional work is information system. The expert report is equivalent to other members of MDT and is part of discharge letter for patient. Why? Why is the purpose? We must have control under control asthma, especially severe asthma, ensure that the patient understand the disease, understand the severe asthma, the treatment, enable the patient to gain knowledge, skills, abilities, and responsibility, and especially self-control management. Why patient education? We see incorrect inhaler technique was over 15%, low adherence. Why? There are obstacles and causes. Obstacles may be patient illness, medication, socioeconomic status, or healthcare system. And causes may be intentional or unintentional, but it's on us to figure out what is the obstacles and what is the causes. Key points of patient education. This is very important. Information about severe asthma. We must teach patients what it means, use images, explanation, what is the sign of exacerbation, measure to take in case of exacerbation, correct use of peak flow meter, why it is used, how it measured, why it's so important for them, for us, and in check device. So this is device, it's training tool for assessing inhale technique. This is very important. Correct inhaler technique. We have a lot of different devices. We have pressures, meter doses, dry powder, soft mix inhalers. We must teach patients how to correct these devices to give them instruction, real instruction, correct instructions. Self-treatment plan, writing instructors, when to took it, what medicine took it, and why to took the medicine. And asthma control, how they control asthma at home, and self-management, they must provide knowledge, skills, and responsibility, and especially breathing exercise. This is very important, and I observed that patients don't even know about this breathing exercise. And most important is that education is individual. We don't educate a group of people with asthma or severe asthma. We take it education one-on-one. Registered nurse must give quality, effective patient education. She suggests changing the inhaler, writes a professional report with discharge letter, instructors for patient, and the patient is managed in the clinic by qualified registered nurse to control the correct inhaler technique, peak flow meter, instructors, give him support, help with self-management, monitor his progress or no progress, and taking appropriate action. What about the patient? Patient in multidisciplinary team in Slovenia is a short waiting line. He came in regular controls. We monitor the patient, the clinic of registered nurse. This is high quality patient treatment and safe communication in monitoring. We must know that while docs are trained to give a fish to a patient, nurses teach the patient how to catch a fish himself through education. Thank you, and I apologize. I am a little bit nervous.
Well, thank you very much, Maya. That was really splendid. Very much to the point. Very practical advice, and thank you very much also to sticking to your time.
Yeah, next time I will be better. I promise.
Practice makes perfect. Okay, so welcome back to the others. So we have plenty of time for some really good questions and answers. So if I could kick off with one question that caught my eye from a person who wished to stay anonymous, but they asked for me a very important question. How does Dominique stay positive? So Olivia, in the Q&A, you chose to respond to this question. I don't know whether you wanted just to raise this question or whether you wanted to give your perspective on it.
No, it was to ask Dominique.
Okay.
I thought it was a really important one because we all need coping strategies, and it's best to learn from each other.
But I will ask you as well to say how you stay positive, because I think you are marvelous. So Dominique, again, I've known you for many years now, and despite the difficulties that you so eloquently described in your chat with Vanessa McDonald, I've always seen you as a positive person, as a fighter. How'd you do it?
I think in part it's my nature, but it's also, I feel like there's very little point in looking at the impossibilities. I prefer to look at the options. And when I first, years ago, I found out I have all these food allergies, and then people said, oh, but you can't eat this anymore. I said, okay, then I don't eat it. I'll figure out what I'll eat then. So I feel that it is my life, and I need to figure out what I need to make it as enjoyable as possible, which is one of the reasons I do my patient, or I can't work anymore, but I need to do something that challenges my mind. And I found that being a patient expert does that and gives me the option within the limited possibilities to use my mind and I think everybody needs to figure out what's essential for me to have a feeling that with all the limitations, my life is still worthwhile. And it's not easy. It's definitely not easy.
Is there an element of acceptance in what you're saying?
Yes.
Seems to be accepting, you can deal with the devil if you can do something with it. But
yeah,
you just kind of learn how to.
Yeah, and there's also a pitfall in acceptance, because I tend to not put too much emphasis on everything I can't do. And that makes it sometimes difficult to formulate to my care providers how bad it is.
Okay.
Mm.
Olivia, would you add anything to that? I mean, how do you cope with your asthma?
I think a lot of the people who are attending this who know me will have seen me over the years, and I've been through that sort of anger, grieving period, I guess. But I find it didn't actually get me anywhere, and I'm very much now, I find something I can do. So my asthma's essentially ruined my life in many ways, but then I've had some fantastic opportunities from it. And being involved in programs like SHARP and research, it gives me something positive to do, because I'm being surrounded by people who are dedicating their lives to help me get better, essentially. And the one thing I do find is that no matter what, asthma can take whatever it likes away, my ability to play sport, whatever, but it can never take away me being able to use my voice as a patient to try and help others, which is why, like, I set up the peer support group, because it's just a positive thing. It's doing something good out of a really bad situation, and you've got to always look at the positives. Don't get me wrong, I have many down days, and people will know that it's not always positive, but you thrive on the positives.
I see lots of symbols of approval, the thumbs up and the hearts being thrown at the screen, which means that much of what you're saying resonates. So that's from the patient perspective, and from Vanessa and Maya. When you hear these stories over and over on a daily basis. So, any tips, if I may say so? I know this is not a tip as such, but any wisdom that you can share? How do you raise the morale in your patients? So, Vanessa, maybe you. How do you go about it?
Yeah, so I think the first thing I just wanted to add to that is that, and this is through patient contact as well as through qualitative research, is that in the qualitative research in people with severe asthma, one of the themes that repeatedly comes through is resilience. So this patient population are burdened on a daily basis by symptoms and by complications of their severe asthma, but the resilience that they show is that they just get on with it. They, it impacts their disease, but they'll get on with it and enjoy and make the most of many aspects of life. And I think that's a real feature of this disease. But how do we kind of keep people, I guess, motivated to, do the things that Olivia and Dominique have talked about? I guess one of the things we talked about, medications that might necessarily work all the time. But one of the things that I think is really important is identifying, well, what are the biggest problems for people who have severe asthma? And that's one of the questions I ask people in clinic is, what's your biggest problem? Identifying what that might be, and then looking at some strategies that might be able to help with that. And that might not be a medication. It might be, my biggest problem is I can't go with my friends on Saturday for a walk and things like that. And the answer might be trying to target some exercise training or some physical activity, etc. If their biggest problem is that I feel really down because my treatments aren't working, then try and look at some strategies that might help with those symptoms of anxiety or sadness. And So I guess kind of I always come back and always come back to this individualized approach, because whilst we might not be able to improve the biology, there are other things that we can do in partnerships with people who have severe asthma to try and improve other aspects of life. And Irantzu, I think, talked about many of those things, physical activity and the impact on mental health, etc. So I guess they're the things that I kind of go to when the treatments might not necessarily be working as we hope.
Thank you for those thoughts, Vanessa. Irantzu, I'll come back to you in a moment, but if I can just ask Maya, how do you lift spirits of your patients? How do you do it?
Thank you.
You're a positive person.
Yes. First of all, we must have a time for them. This takes time. They must feel comfortable, and they must know that we are here for them. They had a contact phone from us, email. They know they are safe with us in this partnership, but this takes times and people and the space. But it's on us to talk to them. First, talk, then go on.
Absolutely. Listen and
yes.
Talk. Listen and talk.
And I agree. Every asthma is not the same. It's different people, different story, different inhalation device. It's so many things. So one patient, one story. Focus on that and work on that.
Excellent. Thank you very much.
You're welcome.
Irantzu, if you can unmute yourself, please. Is there something that you would like to add? You produced a really wonderful video, and I very much enjoyed listening to your sharing your experience, which, like many patients, has been difficult. So, anything that you'd like to add on top of what you've heard from Olivia, Dominique, and our two experts?
Well, I think the information and the education in the asthma is the most important phase in our pathology, and I think accompanying the patient is essential too in all phases of the disease, and being accompanied and feeling understood is very important. You speak with others patients as you. So this connection, I think it's fundamental, is essential for the patients to have a good life. No, I think the connection with patients and with experts, it's basic for fundamental part to our disease, in this case asthma. No.
Yes. What? Thank you for those thoughts, Irantzu. What I found with your talk, that you exuded positivity.
Yeah.
And I just wonder how you can infect others with that enthusiasm. And so I just noticed that, Olivia, you posted an invite to everyone to join the panel. Do you want to elaborate on that?
I try to people to do physical exercises and respiratory physiotherapy, because I think the physiotherapy is essential to the patients and improve the lung function. So these things activate the patients. So I think it's necessary to activate the patients to be an active patient.
Excellent. Yeah. Olivia, over to you.
Yes, so I was answering a question that came into the chat asking about SHARP, and if it was just European and wanting to find out more, so I was posting the link to the SHARP website and also about the patient advisory group for SHARP and European Lung Foundation if people were wanting to get involved. So that I posted that there. But there was a question I was wanting to take from the question and answer bit for their answer, and it was Brenda asked, she's put, is pheno and spirometry the best way to check the lungs? And I know in your video you mentioned about doing peak flow and things to measure. So do you do your peak flow at home, and then in the hospital do you do different lung function as well? And do you find that works for you? Or Dominic?
Iretu is on. It has unmuted herself.
I'm not sure her microphone's working. Dominic, do you want to answer while Sue's working the microphone out?
I'm the wrong person to ask. FEV1 doesn't say much about my breathlessness, and I do have a peak flow thing at home, and I haven't felt that it adds much. But I think for very, very many people with asthma, it is really, really helpful if you have it at home, either digitally or like what Irantus showed us, the non-digital version, to check what's going on when you're not sure, and like what Irantus said, to sort of follow yourself and the fluctuations. And for many people with asthma, FEV1 is a good measurement of what's happening. And I think we need as many types of measurement as possible to get the data together for both the patient and the doctor to get a better understanding of what's happening.
That's fantastic. Aransu, do you have anything to add about the way you monitor your lungs at home?
Yeah, I use the peak flow every day, in the morning, in the afternoon, and in the night. And I take the number in this paper, so this possibility me to see how my asthma is going up. So depending of the results, I have one medication more or less, or I have to call my pneumology, or I have to take another.
So you have your personalized action plan.
Yeah. Apart, I take the oxygen, the temperature. I look if there is any change in my body that I think it's important to take in a paper. So I speak with my pneumologist and I say, well, I have this crisis, I have this corticosteroid done, I have so I have real dates, no? So that's the way that I auto control my disease, no? It's important to the patients that that autocontrol, no? That to recognize the symptoms, so you are better, so you are worse. You have to hear your body, no? So you for that you may recognize that symptoms.
Yes, they're all very in tune with what's going on inside. And I as you were speaking there, so Vanessa's head was nodding in agreement with. And
Yeah.
do you want to add anything, Vanessa?
Well, I was going to say, I think what's important is that everyone do some self-monitoring of their asthma. And when Dominique spoke, she talked about her monitoring her symptoms, so knowing what her symptoms are like each day and when they're starting to increase. And Aransu spoke about the peak flow measure. Others might use some FEV1 monitoring at home. And I think it comes back to knowing what your asthma is like on a day-to-day basis, and then being able to recognize when it's worsening. And, you know, in the clinics, there might be other measures like the pheno and like the spirometry that kind of help the healthcare team track people's asthma control over time. Dominique has her hand up.
Yeah, one of your answer triggered something in me. So I speak to a lot of patients with asthma, and what I see is that quite often doctors forget to explain what the symptoms are. So they have no idea that whatever is happening has anything to do with their asthma, and they might need to take more medication. Or so I think there is a need for better communication with the patients as well, sort of, and these can be the symptoms, and this is how I sort of start monitoring yourself and see which ones are the ones that are important to you. And I feel it's as if we as patients just know what the hell asthma is doing with us. So I think that's an aspect that needs to be addressed more often.
Okay. Olivia, I've just looked at some comments and questions, and I get a feeling that there's a theme that's coming out. You know, how do patients put themselves at the center of the issue? In other words, how do they get their needs met? How do they get heard? But sometimes it's not just being heard by the doctor or the nurse who's responsible for them, but it's also having access to the right kinds of services, which then elevates the whole issue to a health planning issue. And, you know, we're very fortunate that we have participants today from literally all over the world, you know, all continents. I haven't seen anybody from South America, but otherwise all the other continents are present. We got people from India, from Africa, we got from the US, we got Australia. And so, I don't know, my questions to you all of you, is how do you think, give one suggestion at least of how we can get the patient's needs heard with greater impact, with greater benefit for them? How do we do that?
Is it to me?
Vanessa, maybe you were nodding quite.
Yeah, I know, because I can't answer this by saying one thing. I've got so many things to say about this.
Please do.
I'll try.
Your experience is enormous.
Pardon?
You really got good experience in relation to my question. So please fire off.
A couple of the things you said was about not just our not just the doctors and the nurses, But I think, you know, the community in general, employers, you know, services within the community where people might hear that someone has asthma, but also hear all the television ads saying that you can control asthma. Asthma is not something that should control you. So I think people with severe asthma have a bit of difficulty in actually having their conditions recognised as a severe condition that has that daily burden. So it is a really difficult navigation, I think. But some of the ways that we can have the patient placed in the centre, which I think is so important, is in empowering people who have severe asthma to understand their symptoms, understand what to expect from their treatment, to understand what the expectations of their treatments are. And recently there's been some publications that look at patient charters for severe asthma. So and there's one that's a severe asthma patient charter that has 6 principles, knowing that I should expect A, B, C, D, E, and F from my asthma treatment. And I think taking those tools and using them in order to place yourself in the centre is what's really important. Knowing what to expect and knowing the questions to ask when you go to your clinic, so that you become part of the team. And I mean, we can say become part of the team, but not everyone in the world practices in a partnership, and that's unfortunate, but it's true. But, you know, placing yourself there by knowing what the expectations of treatment are, by knowing where to go for treatment and advice and things like that, I think is really important.
Thank you. Thank you for those thoughts, Vanessa. Iranzo, if I can ask you, because you're not just a person with severe asthma, but you are involved in a local patient organization. So how do you use the organization to help you and to help your fellow severe asthma people with severe asthma? How do you do that?
Yeah, I'm the president of ASMAVI. It's an association which helps people affected by asthma, not only patients. There are fathers, mothers, people who cares of someone with asthma. So we are an open association in asthma, and we help giving information, giving education, giving comprehension, being with the patients in all the phases, with the diagnostic, with the treatments, with the style of lifestyle, no? So we make videos of different specialties. For example, respiratory physiotherapy, how we can to use the inhalators, because we have many inhalators, and many times we don't use that correctly. So these videos are all with professional people. We have videos with information. So what is severe asthma, with what or how you can to make an spirometry, what is an bronchostatic, And we try to give all the information of asthma and all that, all the diseases which is which have a relationship with asthma, and we do some days we stop it. And my English is not very good, so you see, but I try.
Just fine. That's fine.
We make wait a minute. We do journeys, vale. We do journeys with the patients to make a physiotherapy class, or and we make meetings. That's the word. We make meetings for the patients to speak about the asthma, about new treatments, about the biological treatments. We meet. We make meets to make mindfulness, to make something with our mental health care, because we think the mental phase is not included in the asthma treatment.
Yeah.
So we try to complain that that things that the system today doesn't give to the patient.
Yes, you have signs of approval on the screen.
Yeah. And we have some two legal support for our people to make different processes which have to see with the disease, no, the asthma.
Okay, thank you very much.
Thank you.
I've just looked at the watch, and I've actually overshot the time that's been allocated to this session, but we could go on and on like this, and I'm sure there will be plenty of opportunity in the future to come back to some of these issues. But for now, can I thank all the speakers and all of you who have posed questions, really good questions. Again, we'll try to respond to them all online. So we'll take a break.
Sorry to interrupt. I was going to say, so Dominique and Vanessa had a poll that they were wanting to do.
Oh, I beg your pardon.
I just wonder if perhaps
I didn't see that.
So we are sort of needing to move into lunch, but I don't know if it's possible we could put the poll up and just leave it on the screen so people can see it, sure, while they're having sort of lunch and things, so they can.
Excellent. Okay, it's on the screen. I can see it.
So if people wanted to answer that.
Is there anything else I've forgotten?
No. So it'll be lunchtime now until 1:35.
1:35 Central European time.
And
12. What time it is in California and India and Singapore and various other places. So, we'll forgive you for dropping out. Anyway, so a splendid session. We'll put a stop to it now and see you then in slightly more than half an hour, and enjoy your lunch or whatever you're going to do now.
Thank you.
Okay, thank you. Bye.
Yeah.
Thank you.